This is our plan to lower the burden of disease in Kenya. Kenya is located in the developing region of sub-Saharan Africa. As a developing country in Africa, Kenya suffers a large burden of disease from HIV and AIDS. Lower respiratory infections and diarrheal diseases are the other two top contributors of DALYs in Kenya, although both prevalence rates are declining. While the major burden of disease in Kenya stems mainly from communicable diseases, the top causes of death demonstrate a different trend. HIV and AIDS was still responsible for a staggering 41% of deaths in 2010. However, the following three top causes of death are non-communicable diseases, which suggests Kenya is progressing out of the first stage of the epidemiological transition. The top causes of death and the burden of disease illustrate the largest health concerns facing Kenyans and have allowed us to target our most vulnerable population, namely women and children. As such, controlling the HIV and AIDS epidemic, addressing child and maternal health, and allocating resources to the treatment and prevention of non-communicable diseases are our top priorities. The first case of HIV and AIDS was reported in Kenya in 1984 and since then has reached epidemic levels. The rapid spread of HIV and AIDS is due to risky sexual behavior, educational deficits, and conservative cultural practices. Returning to our vulnerable population groups, women are more disproportionately affected by HIV and AIDS than men, which increases the risk of contraction by children due to mother-to-child transmission. Although the HIV and AIDS epidemic has shown a relative decline over the past 5 years, mother-to-child transmission rates have remained constant at a rate of 14%. Upon positive testing, we will instate a specialized birth plan that includes cesarean delivery and a restriction on breastfeeding. Cesarean delivery should be conducted at 38 weeks as infants passing through the birth canal are exposed to HIV in the mother's blood and other body fluids. The delivery must be a cesarean because it reduces the risk of vertical transmission of HIV. A baby breastfeeding from an ill woman will increase the risk of infection via body fluids. As an alternative, the Kenyan government should subsidize baby formula in order to prevent transmission. In order for our specialized birth plan to be effective, Kenyan women must become more educated on the practices of family planning. 1.4 million Kenyan women have unmet family planning needs, and 43% of pregnancies are unplanned. Our educational strategy will specifically target pre-pregnancy education on the use of contraception and mitigate the spread of STDs. Globally, the use of contraceptives has increased to 70% of women, which has allowed birth rates to fall from 6.7 births per woman in 1967 to less than 2 births per woman in 2000. Improving education will support our main goal of reducing the number of unplanned pregnancies. Currently, Kenya has the funds for non-communicable disease treatment and control. However, no national response system has been implemented. After analyzing mortality trends in Kenya, cancer increased the most significantly in comparison to other non-communicable diseases. Thus, our action plan will direct funding towards combating cancer, which accounted for 8% of total deaths in Kenya in 2010. Tobacco use is a leading cause of cancer as well as deaths due to cancer. This is a result of aggressive marketing strategies used by tobacco companies to acquire more customers. We recommend shifting current funds towards promoting educational anti-tobacco campaigns, as well as raising tobacco excise taxes to reflect the World Health Organization's benchmark of 75% of the retail price. Raising prices due to higher excise taxes will drastically reduce consumption by children and low-income earners who cannot afford the higher price. The anti-tobacco campaign will consist of two components: improving packaging content and banning advertisements, as well as reducing exposure to secondhand smoke. To improve packaging and ban advertisements, we will increase graphic and text contents of warning labels, standardize packaging, and implement bans on direct positive advertising. To reduce exposure to secondhand smoke, we plan to enact laws prohibiting smoking in public areas such as health facilities, schools, and public transportation. Our action plans focus on improving the educational reach throughout Kenya to target vulnerable population groups. Specialized birth plans and family planning practices address reducing the contraction and transmission of HIV and AIDS, while shifting funding towards controlling non-communicable diseases mitigates its burden throughout the epidemiological transition. As Kenya progresses, education is paramount and will help significantly improve public health development for upcoming years.